Phases of perioperative nursing. 1. Preoperative phase. It begins with the decision of the doctor and patient to perform surgery and ends with the client's transfer to operating room table. During this phase, the patient should get the accounting clearance and informed consent for the procedure. This phase, the nurse should get the baseline assessment like taking the history and orienting the patient that he or she will receive anesthesia during the procedure. For example, February 7, 2011 is the scheduled date for surgery. Luckily, AIC student nurses are scheduled for operating room exposure. In preparation for the procedure, the surgical nurse instructed the patient in nothing per RM diet and wear a surgical gown. The OR nurses will get the patient from the ward per wheelchair or stretcher with the patient chart. 2. Intraoperative phase. It begins when the client is received in the OR and ends with the admission to the post-anesthesia care unit, PACU or recovery room. Before entering the operating room, the OR nurse should check for dentures, allergies and others, which is line with the checklist. After the interview, nurse should provide surgical cap to the patient. Then transfer patient to operating table, hook the intravenous line, administer the IV medication, physiologic monitoring. Nurses assist the anesthesiologist to position the patient during the induction of anesthesia. Circulating nurse will open minor or major pack for the procedure. Scrub nurse performs surgical hand washing and gowning in a sterile technique and initial counting of sponges, instruments and needles, then prepare everything accordingly. Skin preparation done by the circulating nurse. Surgeon arrived, then surgical hand washing done. Scrub nurse serve the gown to the surgeon. Circulating nurse start the operation by saying,
"It seems that we are ready to start the procedure. Let us take a time out to confirm that patient Michelle Gulman in the procedure of appendectomy. May I request each member of the surgical team to introduce yourselves according to your role. Dr. Normie A. Canada, MD, the surgeon. Dr. Dinave Chanet De, MD, the anesthesiologist. Julie the Evangelist, RN, Scrub Nurse 1. Aliana Marie Asperga, SN, Scrub Nurse 2. Giselle Doler, SN, Circulating Nurse."
And the others present on the setting. Oswald Lasaka, SN. IC Faith Cuzgalan, SN. Jail Infesto, SN. Jenny May Ramos, RN, the clinical instructor.
Let us pray. Amen. The initial counting of sponges, instruments, needles and sutures is complete.
The assistant of the surgeon will place the towel at the operative site. The scrub nurse will pass the towel clip, then push the Mayo tray near the OR table. Scrub nurse serve the scalpel and sponges for the start of the operation. Circulating nurse will take note the time started of the operation. During the operation, the circulating nurse will always anticipate the needed things because circulating nurse is not in sterile field or in the operation. When the specimen out, the circulating nurse will take note the time. The first counting of sins when the closing of the fascia. The second counting is done when closing of the subcutaneous. The third and final counting of sponges, instruments and needles when closing of the skin. Clean the patient's body for body fluid secretions. Prepare the patient to transfer post-anesthesia care unit or recovery room. The student nurses will clean everything that was being used during the operation, but one student nurse will stay with the patient in PACU. 3. The post-operative phase begins when the client is admitted to post-anesthesia care unit and extends through the follow-up home or clinic evaluation. Indoors patient to ward for continuous close monitoring.